Hello everybody and welcome back to X the Stress. Today we are extremely lucky to be speaking to Dr. Stella de Kock, who is a neurologist specializing in adult neurology, and she's an avid hiker. So Stella, thank you so much for speaking to us today about what goes on in our brains when we're exercising. So I'm going to cut to the chase and dive right in. That I think over the past few weeks we've starting the conversation on the fact that physical activity is not only good for our physical bodies but also really good for our mental well-being. But we would love to know how that is. What's going on in our brains when we exercise that's so good for us?
Well, actually, there's a big emphasis on exercise in all the guidelines for all the neurological disorders, be it primary preventative. There's some data for secondary preventative, but also for tertiary preventative. And they are, I think before we start talking about exercise, why don't you just differentiate between physical activity, which is just muscle movement, doing work for your daily activities, versus physical exercise, which is a repeated, sustained movement for a prolonged period with a certain goal. So the neurological benefits are actually with physical exercise more than physical activity. The reason I say that, a lot of patients would say, but I'm not inactive. But there's a difference between being active and actually exercising. So when you actually do exercise, the first thing that happens in the brain is really good data to show that there's increased perfusion to your prefrontal cortex. And we know good brain blood supply, good brain oxygen supply, good brain nutrient supply. So that's the immediate effect. With longer prolonged exercise, and with most of the studies use a norm of about at least 30 minutes a day for at least 3 days a week. And then most studies did measurements after 6 months of prolonged exercise. There's clear increase in some of the brain neurotrophic factors, such as brain-derived neurotrophic factors, BDNF. There's an insulin growth-like factor and other neurotropins that actually increase. And we know those neurotropins, when they increase, they actually improve neuroplasticity, they improve neural growth, they are angiogenetic, in other words, new blood vessels form, they slow down cell death, and they improve mitochondrial function. And all these functions together actually cause your neurons to live longer. So your neuronal reserves actually last longer. So you have a greater long-term neurological benefit from sustained regular exercise.
So regular physical activity is that golden bullet for making us stay younger, at least our brains stay younger.
Absolutely, it certainly slows down the degenerative brain disorders. There's really good data for that.
Sure, that's amazing. And now how long, so ideally we want to be exercising, and as you say, intentionally exercising. So if I have a job that I'm just on my feet all day, that doesn't really help. I've got to go and take leisure time to go and be physically active.
It's about the same repetitive action for a prolonged period of time, which differentiates exercise from activity. And it's about that repetitive exercise that actually stimulates your frontal cortex and your prefrontal cortex and all the connectivity with your basal ganglia and your cerebellum. And that when you think about brain function, it's all about neural networks. So the more networks you can stimulate for prolonged periods, the better networking your brain does, with obvious benefits.
So would the benefit from doing, say I'm a runner, so I'm going to use running as an example. If I go running 3 times a week for 30 minutes, is that more beneficial than having one session of running and one session of weight training and one session of Pilates, for example? Or is it just any physical activity that?
Well, the sources that I read pointed to aerobic exercise being the main beneficial exercise. It would appear in older individuals, short periods of high intensity exercise may actually be more beneficial cognitively. But that's a small study, and generally most studies just point towards regular aerobic exercise.
Fantastic. That's great.
Of any kind, yeah.
So we're going to do our 30 minutes, 3 times a week of aerobic exercise. How long does it take us to feel the effect?
Okay, so
how quickly does it work?
Well, brain perfusion immediately, right? Immediate improvements in cognition, in concentration, reaction times, problem-solving skills. And they've actually done a very interesting study on adolescents where they had them exercise an hour a day, 4 days a week, prolonged period, and then they ran all sorts of basically psychometric tests on them. And what they found is a clear improvement in math ability, clear improvement in concentration, clear improvement in impulse suppression, and then of course all the psychological benefits, reduction in anxiety, reduction in depression, even certain obsessive OCD behaviors were reduced. So there's a major, so a lot to be said for repeated exercise over a long period of time, emotional benefits as well. Of course, they've actually done rat models where they had rats on treadmills, and while the rats were on the treadmills, they had probes in their striatums, and they measured increased BDNF in the striatum of rats. So of course in humans you can't do that. So, but what they do is they do have patients exercise, and on serum they do basically break down products of BDNF, which they can extrapolate then would relate to BDNF in the brain. And there's a clear increase in those neurotrophins.
And just to be clear, BDNF does what in the brain?
It improves neuroplasticity, which is your brain's ability to make new novel connections. It improves angiogenesis, which is the formation of new blood vessels in the brain. It improves mitochondrial function in the neurons. It slows down cell death in neurons. So there's a whole host of effects that BDNF has that prolongs your neuronal lifespan and maintains your pool of neurons, which is actually amazing, you know, for immediate benefits.
Immediate benefits, but it also sounds to me, with all these good things going on in the brain, does exercise and physical activity then protect us from degenerative neurological disorders?
Well, there's actually good data. I have a bit of an interest in Parkinson's disease, and in Parkinson's there's very good data that a lifetime of good physical activity has clear reduction in rates of motor deterioration in patients with Parkinson's disease. And that would be prior to diagnosis. There's some less robust data for once the diagnosis has been made, but definitely reduction in motor deterioration, just with regular aerobic exercise. Cognitive decline, everybody's heard of Alzheimer's and dementia. Definite benefit of exercise as well. It's actually solid proof that if persons from the age of in their 30s and older exercise regularly with aerobic exercise, the rate of brain atrophy, volume loss, is actually slower, and specifically in crucial brain regions such as your frontal cortex and your hippocampus, which are crucial for memory. So you can literally maintain better volumes over a period of time.
Gosh, so it sounds like physical activity is crucial for young people, for children and adolescents. It's crucial in the middle age to lay the foundations to prevent us or help prevent from having early onset dementia.
And I think it's never too late to start. Even older patients, it's always a good time to start. It's always a maintained benefit, cognitively and neurally.
It's absolutely fascinating.
Yeah, I think there's a lot to be said for exercise, and yeah.
And if we're looking, we've spoken about it's almost comparable to a pharmacological antidepressant or drug. It's got a rapid onset and it lasts a long time. It's very effective. It's cheap. In fact, it's free. But the last thing that we then need to consider is it possible to overdose? Can you get too much of a good thing?
Well, and with many things in life, moderation is key. There's actually interesting data. We all know about certain sports. We have repeated soft head injuries, increased risk for Parkinson's-like picture. That's a well-known phenomenon. There's also good data to show that certain sports, such as American footballers, they actually took data from the 1960s through to mid-2020. And there's a fourfold increased risk for certain neurological diseases such as motor neuron disease, and especially, and even in the group of all the footballers, is the ones with longer careers, on average 2.5 years longer than their peers, went on to develop motor neuron disease. So there is definite, there must be a turning point where too much of a good thing is no longer a good thing. But I think with all things, the guidelines do point to aerobic exercise and rather regular sustained exercise, again, which to me would mean more like a healthy, active lifestyle with regular exercise,
Yes.
which would be better than certain, almost like binge exercising,
Right.
if you can put it that way. Yeah.
It makes absolute sense.
Yeah. And then interesting, the WHO actually advises that all children exercise at least an hour a day. And most of the studies, if you look at all the cumulative studies, they're all, more than 80% of adolescents exercise less than that, less than an hour a day.
Gosh.
Which is actually quite alarming if you want to establish a lifestyle of regular exercise and all the preventative measures together with, that's part and parcel of a healthy lifestyle. So that would be really something to focus on, to really encourage children to actually just maintain a regular exercise program as part of a normal life.
Yes. And Stella, is there any difference between indoor activity, so if I'm running on a treadmill in a gym, versus outdoor activity running on a road in a city versus running in a natural environment?
So actually I found a very interesting source that actually said if you exercise outdoors, there's much more sensory input and much more sensory integration. You're dealing with different terrain, different temperatures, different sounds. Much more sensory input goes into it. So you're actually stimulating a lot more of your brain regions versus on a treadmill where it's fixed pace, fixed rate, less sensory input. So there's a lot to be said for outdoor exercise as improved. You get more neural networking in your brain versus on a treadmill. Yeah.
That's very interesting.
Yeah, and I think, the environment's beautiful. There's this whole emotional aspect to it too, which I think is greatly beneficial. I mean, biologically, we're all really geared for movement, right? And geared for, to be part of nature. So I think there's big value in outdoor exercise.
It's just awesome that to be able to explain to people that there are actually changes going on in
Measurable.
your brain.
You can actually see it on functional MRI, you can see it on PET scan. Like I said earlier, in the mice, you could actually prove it. In humans, you can't go and do the same studies, obviously. But if you do functional MRI and you literally measure which brain areas are metabolizing now, it's clearly more, with patients who exercise regularly. And for me, what's of great value is preventing brain volume loss.
Yes.
I mean, that's of the essence for healthy brain aging and independent aging. It's very important.
And how long does that last? So if, say, you are in your 30s and you're exercising a lot, and then you get to your 40s and kind of stop exercising as much, how long do the benefits last?
I honestly don't know. I don't know.
Interesting.
What was interesting to me is the blood perfusion benefits immediate,
Yes.
even on one exercise session. With sustained exercise for a couple of months, you get actually chemical changes in the brain, which would then mean neural networking changes, which is amazing. And then one would assume that volume changes would be, measured over. They would have to do serial follow-ups on the same patient, right? But there's clear benefit in not losing hippocampal volume. And hippocampal volume is all about short-term memory and working memory and, day-to-day functioning cognitively. So that's really, really crucial.
So the moral of the story is exercise your whole life and don't stop.
Yes, and not to the point that you injure yourself, just regular aerobic exercise.
It's so interesting. I'm busy reading Born to Run by Chris McDougall at the moment. And I just read a passage last night where he says that you don't stop running because you get old. You get old because you stop running.
Yeah.
And that's exactly it. Is that if you keep on exercising and keep on running, then you actually stave off old age for the brain.
Massive effect. I mean, if you're running outdoors, you're stimulating so many brain networks at the same time. Balance, sensory, visual, auditory, and not motor. Even a large brain surface is dedicated to muscle movement. So you're actually exercising all those brain areas, which is crucial for all your networks. So the more you actually exercise and you planning your next exercise or trying a new exercise, it just builds new neural networks. And with the brain, the stronger the networks, the better the function. And you can't just get that from one single event. That must be a sustained lifestyle to get the benefit. Yeah.
And big benefit there is, so it's worth sustaining it.
Well worth it. Brain health directly relates to independence. So the moment the brain health is not optimal, independence becomes threatened. And for most people that would be a major deterrent.
Yes.
They would really want to prevent that at all costs. Yeah.
So I think not many people are taking this aspect of physical activity for mental wellness.
I think also for the mental wellness, that whole, your cingulate cortex and your prefrontal cortex, they hyperperfuse when you exercise, and that's where depression sits, right? It's right in the brunt of that circuit of Papez that drives depression. Would make so much sense, to just exercise.
So that's interesting. So that could be one of the physiological mechanisms that exercise
lifts mood.
Sure.
Yeah, so you get your anterior cingulate and your frontal cortex, and it gets hyperperfused, which means immediately you're generating more serotonin, more epinephrine, more dopamine, and those are all the neurotransmitters you need to elevate mood and drive and motivation and all that.
And so that's all from an increased blood flow to that part of the brain.
Yeah.
And is it, if you had to compare blood flow to different parts of the brain, is it the whole brain that gets more blood when we exercise, or is it particular parts that gets a disproportionate amount?
The sources I saw was more frontal cortex, so not the whole brain. And then I did see one source that actually said they could not confirm the other findings, but there were several authors who actually published and said they found increased frontal cortex perfusion on exercise. So, which is, and then in terms of the mood elevation, I mean, there's solid data to show that anxiety, OCD traits, phobias, all those sort of anxious type disorders really improve on exercise for the reason of neurotransmitters. There's just greater release.
And in a very natural way with very few side effects.
Yes, safe way to do it, yeah. And then of course you get all the additional cardiovascular and respiratory benefits as well. So there's a lot to be said for it, yeah.
And it doesn't have to be that much. I mean, okay, I'm going to go and do something a little bit crazy next year, but it doesn't have to be crazy. Just 30 minutes, 3 times a week. And one would assume that if you can't fit in 30 minutes, whatever you can do is better than nothing.
Absolutely. And try different types of exercise, always stay in a learning phase, It's just good for your brain.
I feel like I'm learning every time I run on the trails.
Yeah, true. But I think that's part of the appeal of outdoor exercise. You get all that stimulation as well.
Yes.
Remembering the route, planning a new route, it's all cognitive activities.
That's true, actually. It's all growing that brain.
Absolutely, yeah. So which is, part of the whole benefit of exercise. Yeah.
Well, there we've heard it from the specialist that exercise and regular physical activity is absolutely crucial for children, for adolescents, for middle-aged people like me, and for the elderly. It's for everybody.
Absolutely.
Stella, thank you so much for your time.
No, it's been a pleasure.
I really appreciate it.
No, thank you.
And if you would like to see more of content like this, please do follow us on social medias or subscribe to the YouTube channel. Thank you so much. Cheers. Bye.